There are three different types of incisions that are classically talked about for breast implant surgery, and particularly in Asia, the armpit incision is very popular. In America, the areola or nipple incision is popular because they were using saline implants, and they could get saline implants actually come packaged, rolled up and empty, and they have to be inserted and then filled with saline, and therefore they can be put through a smaller incision, but they're not as good in terms of longevity and in terms of the way that they feel. So in Australia, not a lot of people do an incision through the areola or nipple. The most popular incision in Australia, and I think rightly so, is the incision in the crease under the breast, and that leads to a safer result and a better long-term outcome. And if the scar's not that good, it's a good place to hide the scar, even though it's a very good scar normally anyway. But it's still the best place to hide a bad scar compared to, say, an armpit or a nipple. And there's less effect on nipple sensation, and there's less effect on breastfeeding potentially in the future. So I recommend to my patients the incision in the crease under the breast. By making the incision in the crease under the breast, we can control the pocket that the implant sits in much more accurately compared to an incision in the armpit, because through the armpit the incision goes down a hill and around a corner. You can't really see where the crease is going to be, and it's very important to control the breast crease because that gives the breast shape. By making the incision where we want the crease to be, we can then create the crease at that particular level. So it can be like a sort of a shelf that the implant doesn't slip below, and that has beneficial results for the ultimate appearance of the breast